Trauma and stressor-related disorders. Trauma is our mind's reaction to terrible events that severely hurt or frighten us. While we all have built-in resilience to such kinds of pain and anguish, systems can overwhelm us if an event is too much to bear. Anyone can experience trauma. A World Mental Health survey found that up to 70% of adults have faced trauma-inducing happenings in their lifetimes. Statistically speaking, odds are that most of us are going to suffer from trauma at some point. The older we get, the more the odds go up. Traumatic events can range from serious accidents, deaths in the family, surviving a natural disaster, physical or verbal abuse, being a victim of a crime, military deployments, even divorce. There's no shortage of the things that can induce trauma, and what might cause trauma in one person can affect another person differently. It's very case dependent. Even witnessing the trauma of another person can be traumatic itself, which is what often happens to children growing up in an abusive home. So what happens when we're experiencing trauma? Just like there's no shortage of causes, there's no shortage of symptoms either. Emotional symptoms can include feeling angry, sad, afraid, or even shame and denial. Other unwelcome symptoms can exhibit themselves, such as uncontrollable outbursts, which cause problems at work or home. Common physical symptoms are things like headaches, digestive issues, sleep interference, changes in eating patterns, and more. If severe enough, trauma can lead to other disorders, such as post-traumatic stress disorder, which often involves persistent thinking about the past event. Acute stress disorder, similar to PTSD, with quick onset and faster recovery potential. Disassociative disorder, a sort of escape mechanism where there's a feeling of being disconnected from the past. Reactive attachment disorder, common in children who might display limited emotional responses. And disinhibited social engagement disorder, a scary problem common for kids, where they seem inappropriately eager to bond with people they don't really know. Other disorders that can spawn from trauma and extreme stress include adjustment disorders, anxiety, depression, substance abuse disorders, and unspecified issues that are hard to categorize. As we've seen, kids suffering from trauma or adverse childhood experiences face additional challenges. They're still in development, so having a traumatic incident thrown into their lives can alter the entire course of the rest of their lives. In fact, Kaiser Permanente and the CDC studied outcomes of such cases and found trends that children who survived adverse childhood experiences later go on to suffer more. Kids who experienced abuse, neglect, violence, substance abuse, mental health problems, divorce, or related stressors were more likely to have mental health and other medical conditions. The potential for substance abuse, bad grades, and underemployment also increased. Anyone can suffer from a traumatic disorder, but often children display symptoms that get misinterpreted. Instead of receiving treatment, they're perceived as simply exhibiting bad behavior that they should be able to control. When that doesn't happen, their self-esteem suffers, causing problems to get even worse. No matter what age a person is, if they've lived through a traumatic experience or indicated signs that they have, an assessment by a trained medical professional can help figure out what to do to help them feel better. Now that you know more about trauma and stressor-related disorders, take comfort in knowing that Impireum is on your side to help restore your confidence and quality of life. Call or register with us today, and let's get you the help you need. Follow us on social media.